You have a client with a somatic sensation that isn't shifting. You have tried going back to target. You may even have changed the direction of the eye movements or changed to a different modality, or even asked the client to focus on a different sensory aspect. That sensation is still there. In this video, I will show you some strategies that you can use to help shift that somatic sensation. You can think of these as cognitive interweaves for the body. Please join me. I'm Dr. Michael Patterson, clinical psychologist and EMDR Europe accredited senior trainer. I want to help you improve your EMDR therapy practice. You have the client with this somatic sensation that isn't shifting. Something you might try is invite the client to apply a bit of pressure to it. In fact, make it more intense. If the client is numb, applying pressure, they can feel something. If there is a sensation that is noticeable to them, applying pressure makes it more noticeable too. So by adding in the bilateral stimulation, as they notice that, that may be enough to shift it. Another strategy is to invite your client to give that sensation a number of properties. I would say to the client, as you notice that sensation, if it has a colour, what colour would it be? What size is it? Does it have a particular shape? Has it got a temperature? Is it cold? Is it cool? Is it warm or hot? If it has a noise, if it's making a sound, would it be a low-pitched sound or a high-pitched sound? As the client notices that sensation with those different properties, add in the bilateral stimulation. By doing that, then subtle changes that occur will be noticed by the client. Sometimes a client has a sensation in their body that requires them to move or act in some way. For example, having tension in their legs. Notice that. Add in the bilateral stimulation. Have a breath. What do you notice now? It's still there. As you notice that sensation in your legs, is there anything that you feel you need to do? Well, I feel as if I need to run. Okay, so move your legs up and down as if you're running. So the client could be going, or heel toe very quickly. That way they can release that sensation that isn't shifting. Sometimes it may be tension in their forearms. They need to squeeze something. You may invite the client then to squeeze a cushion. Squeeze it really tight. That might be enough to help release it. Sometimes there may be tension in the throat or the jaw. I would ask the client to notice it. Do another set. If it isn't shifting, it may be words unspoken. I would invite the client to notice that sensation and ask, are there any words that sensation needs to say? Oh yes. So notice that sensation and allow it to say the words that it needs to say. Now, the client may say the words aloud. If they do, that's fine. Alternatively, the client might have it as an internal conversation. If that's the case, that may be enough to shift it. By saying the words internally, it will activate the neurons that would go on to activate the musculature of speech. But for some clients, they will need to say the words aloud. And at times there may be the case that you may have to coach them. You may actually have to say the word for them to copy you, to guide them through it. Particularly if it links back to a traumatic experience where speaking back would have resulted in disastrous consequences for them as a child. You need to support your client through that. Another technique that I've used with these bodily sensations, which is quite fun to do as a therapist, is to invite the client to notice that sensation. If it has a colour, what colour would it be? So let's say the client says it's blue. And if you notice that blue sensation that's there, if it could take a form and appear beside you, what would it look like? It's a ball. And as you notice that blue ball that is there, if it could let you know something or pass a message to you, what would that be? You can let me go. Well, if the message you're getting is, you can let me go, is there any value to you in holding on to that ball? No, there's not. Well, if there's no value to you in holding on to that ball, would you be prepared to let it go? I suppose so. So then I would use imagery with the client. So I would add in the bilateral stimulation and invite the client to see themselves as disposing of the ball in some way. So for example, just throwing it into a fast flowing stream, noticing the stream whisking it away and the ball bobbing up and down as the stream carries it away further and further away from you. And then just noticing the ball disappearing off a bend in the stream and then going out of view. So let me know whenever it has gone round the bend in the stream and it has left your view. And I'm adding in the bilateral stimulation as I do that. The client says, that's it now. Notice your body now. Any sensations there at the moment? Yeah, it's a bit easier. Okay, focus on that. Add in the bilateral stimulation. So that can be enough to release the sensation sufficiently to allow the processing to continue on. So what we're doing there is mimicking spontaneous processing, just the same as when we do cognitive interweaves, other forms of cognitive interweave, we mimic spontaneous processing. That's the sort of thing that might have happened spontaneously. If I have tried that exercise, noticing the feeling in the body, giving it a color, and not inviting the client to make it into an object and see what meaning it has for the client and can they get rid of it. If it doesn't shift, then I would be thinking about the possibility of an ego state that is blocking this. I would invite the client then to notice that sensation in your body and ask it a question. Focus this question on it and ask that sensation there, what do you want from me? At that point then, it allows the client to connect to the sensation, ask the question, and if there is an ego state that is blocking it, then there is an opportunity to find out what that reason might be. If that's the case, I will get in contact with that ego state and ask it the question. Let's say the answer is, I want him to suffer. So my name's Michael. I'm trying to help Jim, and can I ask you, that part that wants him to suffer, what's the reason you want him to suffer? He's bad. And what is it about this man that makes you think that he is bad? So I would explore that with this particular part, find out what the thinking is, and the reason that it continues to do that. So that is the subject of another video, working with ego states, but it will get you to think that that is a possibility. If this video has been of any benefit to you, please subscribe free down below. And then you will be made aware by YouTube of other videos I put up in the series. If you like this video, please do click like down below as well. I want to help you become the best that you can possibly be in delivering EMDR therapy.